It's the same. I was going to tell you guys to bring a sweater so it could look like we were here twice, but
Oh, is it supposed to be two separate occasions?
I don't know. She just said don't submit them all at once. Or I'm going to look like you're doing something. Or you have to shoot your own face. Oh, dear Lord. Okay. Hidden vision problems is the name of this one. To explain, can a bright child be smart in everything but school? Rhetorical question. Up to 80% of all information we receive is visual. Thus, visual skills are essential to learning, working, and even recreation. I recently completed 6 months of vision therapy. The difference in my vision is incredible. While vision problems are not commonly spoke of, 70 to 90% of juvenile delinquents have learning disabilities. Disabling yet treatable vision problems can be missed or overlooked in a standard eye exam. Hidden vision problems can affect the learning, reading, and quality of life if not detected and treated. Vision problems occur when eyes are not working together, sending mixed signals to the brain to interpret. Most people do not know there is a problem because they think everyone sees this way. Adults learn to compensate for the problem and suffer headaches, eye strain, and physical exhaustion. Vision problems affect 1 in 4 children and 60% of the children who struggle with reading. Vision problems have some of the same symptoms of dyslexia, learning disability, and ADD. Research in the Nebraska Optometric Association indicates 20% of kindergartners, 30 to 40% of high school students, as well as 70% of juvenile delinquents have a vision problem. A standard eye exam that is limited to eye health in 2020 visual acuity is not adequate. A comprehensive eye exam with qualified vision therapists or behavioral optometrists will detect vision problems and can avoid many problems. Optometrists and ophthalmologists both have training to detect problems, but because they have no treatment plan, they often do not. Some doctors will not refer because they fear of losing their patients. A doctor that specializes in this field will have the FOVD designation after their name. The additional schooling is usually added as an intern with an established doctor and taking additional education classes. Vision problems may not manifest until the visual stress level increases in 4th or 5th grade, where the increase in the amount of close work is required. In my case, it was 12 hours straight and no visual break. Because when we were in the trailer, I always could look up and see something. In the cubicle, I wasn't looking at anything. Every child should have a comprehensive eye exam before starting school or immediately if older. Many learning disabilities and the labels that go with them could be avoided if children are tested. In addition to being called lazy, slow learner, or working below potential, vision problems affect the eye-hand coordination needed for sports and play.
Alright, are we all about ready then?
No matter the age, this test will still detect vision problems.
Is there anybody who does need or who does not need change?
Most of which are treatable with therapy or surgery. If you want to give a good laugh, go to YouTube and look up Dr. Susan Baring, who's also known as Stereo Sue. She was 48 years old. I think she's a physio or she's a scientist. She had multiple surgeries before finding out that all she needed was vision therapy. While most vision problems can be corrected with therapy, it takes work and dedication to achieve. I hope you have learned enough from this presentation to think about your eyes and to relate this information to anyone who has children. A regular eye exam does not always discover vision problems, problems that can lead to learning problems as well as behavior issues. Don't see half the world, get your eyes examined by a trained professional. You're at 5 minutes. Okay, does anybody have any questions?
Do you know what kind of?
Okay. A lot of the information that I got was from my doctor. I did interview her. I asked her several questions. And I also picked up several of the brochures that they offer. This one, as you can see, this tells what vision therapy actually is. This one is on attention deficit. There is a direct link to vision problems and attention deficit disorder, as well as being autistic and dyslexia. And this one is the hidden disability, and it goes through and it has symptoms that you can look for, things that your child might do or you might do. And this one is basically the same. It's the educator's guide. So instead of a teacher saying, oh, you're stupid, you're not working up to potential, it gives clues for the teacher to look. Does this child, act up when it's reading time?
Yeah, but our teachers trained they're not trained to recognize those things.
Short attention span, frequently omits words, write up or downhill on paper. And when I read all this and I've done all this research, I go, is that why I always wrote that way? Rereads or skips lines unknowingly, frequently loses place. And Paula can attest that before I went through all of this, she'd come in and she'd be reading and I'd be going, yeah, that's nice, I don't read. Because I didn't. And now I can sit and read a whole book and I don't have any eye strain or any problems. So it did work for me. I would be an advocate for anybody, help anybody who had any questions. Computers and vision, that's the other thing. And since you all work on computers, I will give you some tips. I know you've all heard the thing about 20 minutes, 20 seconds, 20 feet. That means every 20 seconds you should look up 20 feet away. The idea is that we focus so tightly on our computer while we're working or we're doing paperwork, we never look out. And our eyes get used to this and they don't focus properly. Yes, exactly. And Andrea did, when you did that, that was one of the things I had to do and I could not do. I had to take a stick and I had to bring it up here until the picture, I got 3 pictures. And when you get 3 pictures, then these two come together. No, it was not happening. I could have 4, I would have 6, but I couldn't get 3. And the more I worked, the more I worked. And the difference from when I was working and I got laid off, the difference in my recovery was tenfold. It was just amazing.
Are doctors hard to find that can do vision therapy?
Yes, they are. They are a very specialized doctor. The other thing that you need to be aware of is most insurance companies will not pay for vision therapy. They'll pay for the doctor's visits, but they will not pay for the vision therapy. So I went for 6 months and paid $75 a week.
Did this help your headaches?
Yes. Yes, my headaches have gone away. My eye coordination is better. I can actually catch something if you throw it to me now, whereas before it was like, yeah, right, not happening. Again, I can read now. I can study on the computer. I had got to the point that I couldn't read the paper without shutting one eye because I had 2 horoscopes in front of me. So it was very bad. Probably worse than anybody even knows. I left work twice, and there was 2 roads on the back road. And that was when I finally said, I think maybe I better go to the doctor. What should I drive out?
Does it do anything for night driving? Do you have?
It does affect your night driving, and the biggest reason it affects your night driving is because of the depth perception. You have no depth perception. And now I could put my car anywhere. I put it in between this little place the other day, and 2 men just went, how'd you do that? It's amazing the difference in my eyes. I don't think I could ever explain it enough.